If you're a veteran with a history of traumatic brain injury, then this information on the new TBI rating criteria is crucial for you to hear. Welcome back to the channel, folks. Dr. Sharma here, physician, board-certified psychiatrist, and Air Force veteran. As always, I wanted to mention that this video is for informational purposes only. It is not medical or psychiatric advice. New criteria has dropped on neurological conditions for VA disability ratings. Now, given my specialty, I'll mainly be focusing on traumatic brain injury or TBI. Overall, the symptoms within the criteria have not changed, but rather it's the grading of impairments. It's more organized and it's grouped in assigned categories. Let's go through the categories and the symptoms. So first up is memory, attention, concentration, and executive functions. As you can see here on the screen, it is graded by level of impairment on a point system, ending with total. So for this section, I use objective testing to look at the veteran's memory. This includes portions of the mini mental status exam, like remembering multiple words, naming objects, counting backwards from 100 by certain number sequences, repeating sentences, things like that. That exam gives me a score that I can then use to determine what the level of impairment is. So as an example, let's say that I tell somebody 3 words, and they're able to repeat it at first, but minutes later, they only remember 1 of the 3 words. And even when I give them the hints, they can't remember the other words either. This tells me that they have problems with memory storage and retrieval. So that's just an example of one of the components of the test, but that's how we make it objective. Next up is the second category, judgment. In this section, I look at what problems you might have with decision making, understanding the pros and cons in a situation, understanding the consequences of actions, things like that. Let's do an example. Let's say someone tells me that recently they had a plumbing problem and the plumber told them, hey, I can fix your toilet for $120, but it's really old, so it might go out again in a couple of months. The other option is you can replace it for $600. Now, in response, the veteran wasn't really able to understand how to weigh that decision, right? How much money is being spent now versus later, and they needed help from their spouse. Sometimes it can be so severe that you might not understand what type of clothing to wear for the weather or how to judge dangerous situations. The third category is social interactions. So this has to do with understanding social cues like people's facial expressions, body language, understanding when a conversation is ending, understanding when the other person is becoming uncomfortable, becoming really paranoid in social situations, feeling like the person might have hidden motives, things like that. Same with this category, I grade it based on how often social interactions are inappropriate. The fourth section is orientation. This is how often and in what way you might be getting confused or disoriented about where you are, what day it is, what you're doing at the time, where you're going, recognizing the people around you, things like that. So as an example, someone with TBI might be very confused about what day of the week it is, whether it's a weekday or a weekend, what they're supposed to be doing that day. Sometimes it can be severe enough that the veteran is in a place like maybe a grocery store and they actually have no idea where they are or what they're doing there. This is because of problems holding on to information in the brain, which then leads to this type of disorientation. Next up is category number 5, motor activity. So with TBI and other neurological illnesses, there's something called apraxia. This is being unable to do skilled movements, right? So this could be things that you used to be able to do just fine, like fastening buttons, tying shoelaces, cleaning dishes. And it's not just that you necessarily can't do those things, but some folks with TBI can still do them, but they're a lot slower in completing them. So it's like the neurological system isn't able to keep up with your intentions. Now to the sixth section, visual spatial orientation. This has a lot to do with problems when driving or walking around. So this includes like getting lost easily, having trouble reading maps, needing to use GPS all the time, sometimes having problems using GPS. With the problems using GPS, sometimes folks with TBI won't be able to keep up with the directions because the turns are coming in too fast for their brain. Again, Just like the other categories, there are different levels of impairment and scores for those levels. Before we jump to the next one, I wanted to mention something. If you do have TBI and you're watching this, remember to bookmark this video and watch it in parts or even watch it again. It's okay. That is part of what you're going through with this. There's nothing wrong with coming back to it later to review again. Okay, category number 7, subjective symptoms. Now, this is where it becomes sort of a list of different symptoms and how it impacts personal relationships, family interactions, functioning at work. Veterans with TBI can have a lot of different subjective symptoms like dizziness, headaches, ringing in the ears, insomnia, hypersensitivity to light or sound, becoming fatigued easily. This becoming fatigued easily is really significant. When you have TBI, there is only so much of a cognitive load that your brain can take at one time. So as you go throughout the day, you become easily fatigued and drained much easier than you used to be. Now, with the subjective symptoms, I realize there's a lot of overlap with other conditions as well. That's okay. The main goal is to capture all those symptoms. Section 8 is NeuroBehavioral Effects. Now, these are specific symptoms and their impacts in different areas of your life. So, for instance, irritability. This is a big one in TBI and other conditions as well. The irritability can really interfere with your family relationships, ability to work with others in the job. Impulsivity is also significant, making quick and rash decisions because your emotions and your responses change very quickly and strongly. You might know this as mood swings, happens a lot in TBI. Another big one is inflexibility. So folks with TBI can be rigid. They can get really stuck on things. So let's say a fuse is blown in the house, and you might really get stuck on that, feeling like it has to be fixed right away, and you just can't shake that thought. Once again, we have different levels of impairments and scores depending on the impacts on your life. 9th category is communication, obviously a big one. This is the ability to communicate by speech and by writing. Do you have trouble formulating your thoughts and putting sentences together when talking to other people? Do you have really bad word finding difficulties? Words that you used to know without any issues, right? You just can't think of them anymore. Even basic things like spoon or pen. When you're in the midst of a conversation, the words just disappear. Can you communicate your basic needs to others, like when you need to eat, when you need to use the restroom, things like that? Last but not least, number 10 is consciousness. Now, this one is very rare, thank goodness. But it's when TBI is so severe that the individual only responds rarely to what's going on around them and basically needs 24/7 care for everything. I will say with TBI, people can also have episodes of passing out or diminished consciousness that way, which this criteria doesn't grade here specifically, but I just wanted to mention that. And that is the new TBI criteria grouping. I think it's very organized and we're more able to separate symptoms of TBI from other conditions. This is something that the CivDiv Clay also talked about on his channel, and I agree. Now, a really common question I get is, Doc, how do you separate the symptoms of TBI from things like PTSD or depression? It's a tough question, and the answer is not satisfying. It depends on each case. Okay, so everyone is different, and with this one, I have to look at each individual case and determine that. But let me give you an example just to walk through this scenario. Let's say we have Richard, a veteran that I just made up. He has PTSD and TBI both. Now, he very clearly has like trauma-based symptoms, right? Like intrusive memories, flashbacks, nightmares, hypervigilance. And with that, I should be able to tell that these symptoms are rooted in his PTSD because they're trauma-based. Where it gets more difficult is cognitive symptoms. So problems with memory and concentration. Those symptoms could be related to PTSD or TBI or both. It can be really hard to separate. Having said that, let's say Richard tells me that when he drives, he gets flashbacks or intrusive memories to when he drove convoys in Iraq, and then he gets disoriented or lost. That gives me a clue that his disorientation is more related to PTSD than his TBI. This is not a 100% rule, but these are some of the strategies that I use. Overall, if we want a more quantifiable way of differentiating TBI symptoms from others, you need to have neuropsychological testing done. This can be done within the VA system at TBI clinics. I'm not able to do this because I'm not a neuropsychologist and I don't know how to do those tests, but that can be done, and it's a definitive way of looking at TBI symptoms, their severity, and separating them from other conditions. Neuropsych testing is usually pretty long. It's for several hours. It might be multiple days. That's it for this video. I hope this was helpful for you guys to take a deeper look at the new VA rating criteria for TBI and how it's organized. If you found this helpful, please like, comment, and subscribe to my channel. It really helps, and it tells me that I'm doing something right. Also, please drop a comment below about your thoughts on this topic, and if you have requests on what to cover in the future, I'd be happy to make a video on it. As always, thanks for watching. Dr. Sharma signing off. See you next time.